Hey guys, welcome back to my YouTube channel, and today we are going to talk about a topic, that is which clinical field should you select for your masters in dental surgery course. I know most of us are here confused. Should I take pedo? Should I take oral surgery? Which field is suitable to you? See, I would not give any recommendations, but I would definitely try to help you out and analyze which field is best for you. So let's start with ortho. Orthodontics is a field which is divided into two parts, that is surgical orthodontics and non-surgical part. In surgical part we actually like how to analyze that you actually want to do ortho. See, ortho is in field which can, it is also called as orthodontics and dentofacial orthopedics. So what does this mean? That you are going to completely change a smile of a person, like how it looks. So basically, if you are a person who wants to bring that skeletal-dental changes in the tooth and want to give completely renovate a tooth of a patient, this field is for you. Talking about oral surgery, now oral surgery is a field of interest for all those people who had that dream to do surgery in their life. So this field is perfectly fine for you, but the things to be noted is that if you take, suppose you take oral surgery as the field of your choice, then 3 years you would have to do an postgraduate course, then you would have to do an oncology diploma course, which are available almost all over India. So basically you're doing your UG, you're doing your PG, then you are doing your diploma, and then finally when you come out, no one is going to give you surgeries in your hand. So basically, if you are going to be an oral surgeon and you are going to open a clinic and do root canal treatments, I would not suggest you to do oral surgery, because oral surgery is a field of surgery, guys. If you are going to do oral surgery and then you are going to open a clinic and do root canal treatments, it is of no use, my dear guys. So basically what you need to do is you need to work under an senior surgeon for at least 3 to 4 years. Then you would build up that experience. When you come out, when you build up that 5 to 6 years experience, you will start getting surgeries. Or either the second thing is that you should have that money backup with you, that you will open up your own hospital and you will start doing the cases on your own. So this is how you are going to select oral surgery. Orthodontics, if you are interested and keen to change someone's smile completely skeletally and dentally, then that field is for you. Even surgical orthodontics is assisted by the oral surgeons. And orthodontics is a one, orthodontist is like an architect. Suppose you are making a big building, so you know exactly which poles will come where. So orthodontics has a software where they you design that where actually the which part of the jaw is going to be cut and how is it going to move, whether it will go 1 mm up, it will go 1 mm down. If you are going to do an surgery of chin, you are basically an architect, and a surgeon is basically the one who is going to build this entire thing for you. So this is how you will differentiate whether you want to take ortho or you want to take oral surgery. Talking about endodontics and prosthodontics. Now, endodontics and prosthodontics is basically bread and butter of dentistry. If you are a person who want to learn more, or suppose you are a person who is not exposed or who is not so confident about root canal, doing root canal treatments, and want to master the endodontics, you want to do you want to do endo with microscopes, and if that is what you want and that is what you are analyzing for yourself, then this is for you. And endodontics is a field, first and the last patient in your clinic is going to be endo. When you do endo, then comes prostho. So endo is the first thing which will come to your clinic. All the patients in India, mostly the patients come to you when they have so tremendous amount of pain or they have swelling in their tooth. So basically they come at that point of time. So most of the tooth go in root canal treatments, and endo is definitely the field of choice if you would like to do if you would like to pursue this field further and you are a person who want to open up a clinic, who want to be independent, then endodontics is a field for you. Talking about prosthodontics. Now, prosthodontics is, talking about prosthodontics, when we talk about prosthodontics, it's about complete dentures, it's about FPD, it's about RPDs, it's about implant supported dentures. So this is going to be, future. Nowadays people, are not are opting more for implants, not that much, but if you think like 10 years from, yeah, India 10 years from now or 20 years from now, every case would be implant. So implant is the future, and if you want to, if you want to be confident enough in your practice, and if you want to pursue, then prosthodontics is definitely the field of choice. Even I asking the senior dentist who have worked for like 30 years in their own clinic have suggested that, even being such an experienced dentist, they need the help of prosthodontist for support, stability and retention of their dentures and of their prosthesis. So this is where prosthodontics is going to come in. So if you think, if you analyze that yourself in that part, in that point, then prosthodontics is definitely for you. Talking about pedodontics. Now pedodontics is a field where, you will learn endo well, you will learn prostho well, you will learn pediatric orthodontics well. So it is basically the mixture of everything. You will learn parts and pieces of everything in pedo. So pedo is an like complete package where you learn even prostho, you learn also ortho, and you also learn how to manage a kid in your clinic. Most of the dentists handle the kids themselves in the clinic, but like more than, I would say, 30-40% of the people are not able to manage pediatric pediatric patients well. So they will definitely call consultant pediatric people. And nowadays people are becoming more aware, and they are like, all the parents are so very much concerned about their child's health. So pediatric dentistry is obviously and good field if you would like to pursue, and you want to take your career ahead. It's definitely a good choice. Talking about periodontics. Periodontics, mostly people think that it is an inferior field. It is not an inferior field. Even in periodontics, talking about an oral surgeon and talking about an periodontist, an oral surgeon may remove a tooth traumatically, but an periodontist is a person who will remove a tooth without causing any trauma. And periodontist is specialized in doing those immediate implants also. So this is also a really very good field. Talking about flap surgeries, let's talk about the reality. In India, if you will tell a patient that his pocket has been reduced by 2 mm, it was 10 mm earlier and now it is 8 mm, so it is improving. So a patient would not understand, and he would not get convinced. This is my point of view and this is my school of thought. I'm not telling that perio is not a good field. Perio is definitely a good field. Talking about the extraction part, a periodontist is the one who will do extractions atraumatically, more atraumatically than an oral surgeon. So periodontist is a field of choice if you are, if you want to do flap surgeries, if you want to do gingival graft surgeries, or you want to do immediate implant procedures. Perio is a field of choice for you. So this is the thing. And talking about one more thing, that and dentist earns more by doing, scaling in his clinic. This is, this thing is a point which you will understand. But scaling can be done by an BDS also, an MDS also, but perio is important. That is what I am trying to tell you guys here, that perio is not an inferior field. If you are interested in doing immediate implants, flap surgeries, or even doing gingivectomies, even depigmentations of the gingival, basically everything related to gingival and periodontal health is going to come under periodontics. So just think about it, analyze yourself where you come. Hope you guys have liked the video. So if you have liked the videos, guys, please like my video and subscribe to my channel. If you have any queries, please comment down in the comment section so that I can get back to you, and I'll help you out as much as possible. Thank you so much for watching my video.